Welcome to Department of Anatomy. I am Dr. Muhammad Mustafa, Senior Lecturer, Department of Anatomy, SRM. Now today we are discussing about larynx. Larynx is the voice box. This is the upper extended part of the lower respiratory tract. It consists of series of cartilages along with the ligaments, mucous membranes and lot of muscles. Now we discuss one by one. First we discuss about cartilages. Now this is the hyoid bone. Below the hyoid bone we have a thyroid cartilage. So in larynx we have paired cartilage and unpaired cartilage. The thyroid one of the unpaired cartilage. It is the largest cartilage in the larynx, which is covered in front of the neck as a protective shield. This thyroid cartilage has right and left quadrilateral lamina joined together in the front. This prominence is called laryngeal prominence. It's called Adam's apple. It is acute in males, obtuse in females. Male 90 degree in angle, in female 120 degree angle. The thyroid cartilage upper border, right and left side joined together, form a notch that is called thyroid notch. The hyoid bone connected with the thyroid cartilage with the thyrohyoid membrane. The thyrohyoid membrane. The thyrohyoid membrane is pierced by superior laryngeal vessels, internal laryngeal nerve. Now, this thyroid artery on the lateral aspect we have a oblique line. This oblique line contains three important muscles: sternothyroid, thyrohyoid, inferior constrictor muscle. These are the muscles, extrinsic muscles of the larynx. And the same aspect and the post aspect of the thyroid cartilage, we have three important muscles: palatoglossus, solfengopharyngeus, stylopharyngeus. These all the muscles elevate the larynx except sternothyroid, which is depress the larynx. Now the posterior surface of the thyroid cartilage contains in the median region three ligaments: hyoepiglottic ligament and vocal and vestibular ligament on both sides. Now come to the cricoid cartilage. Cricoid cartilage is the below the thyroid cartilage. It's connected through thyroid cartilage through cricoid membrane. Cricoid membrane. The cricoid cartilage is a ring shape. It is the only cartilage which circles the larynx. It is called stone of the larynx. Foundation stone of the larynx. It has anteriorly arched, posteriorly lamina. Anteriorly arched and posteriorly lamina. So one of the unpaired cartilage. Now come to the third cartilage, that is epiglottis. The epiglottis is a reflex structure. It is also unpaired cartilage. It has upper border free, two lateral margins, and inferiorly pointed out as a tubercle. It is attached in the median surface of the posterior surface of the thyroid cartilage. Now in this specimen we see the epiglottis attached to the root of the base of the tongue with the three folds: median epiglottic fold to lateral epiglottic fold. Now come to the paired cartilages. The paired cartilages are alternate cartilage, which is situated above the posterior lamina of the cricoid cartilage above, and alternate cartilage is a pyramidal in shape. It has apex, base and two processes. Lateral process called muscular process, and forward process we call as a lateral process. So muscular process is a lateral process. The alternate cartilage apex is attached above, the base attached with the cricket cartilage, lamina of the cricket cartilage. Now corniculate cartilage, which is situated in the apex of the alternate cartilage. It is a conical in shape, situated in the posterior medially to the ari-alternate fold. Ari-alternate fold. Now, just above the corniculate cartilage, we have a cuneiform cartilage. It is a tiny rod-shaped cartilage. It is situated above the cornate cartilage. It is situated in the ari-epiglottic fold. Ari-epiglottic fold. Because from the epiglottis to alternate, a fold is formed, that is the ari-epiglottic fold. So, epiglottis attached with the three folds: median epiglottic fold, two lateral epiglottic fold. The depression we call as a vallecula. Now, so we discussed cartilages. Now discuss about extrinsic muscle. Now we are discussing about inlet of the larynx. Inlet of the larynx anteriorly bounded by epiglottis, posteriorly by interternate fold, and laterally ari-epiglottic fold. Now this inlet of the larynx, it is mainly the intrinsic muscles will be the part of main action. Example, opening of inlet of the larynx, closure of inlet of the larynx. So closure of the inlet of the larynx, ari-epiglotticus, oblique alternate. Ari-epiglotticus and ari-alternate are closing the inlet of the larynx, whereas thyroepiglotticus open the inlet of the larynx. So, intrinsic muscle we have dividing opening of inlet of the larynx, closing of the inlet of the larynx, adduct the vocal cord, abduct the vocal cord, tensor of the vocal cord, relaxer of the vocal cord. Now we are discussing finish the inlet of the larynx, closure of the larynx. Now we are discussing abduction of the vocal cord. Posterior cricoalternate muscle, which arises from the posterior arch of the cricoid cartilage to the alternate cartilage, is a safety muscle of the larynx, which is abduct the vocal cord. Whereas lateral cricoalternate and transverse alternate adduct the vocal cord. Now come to the tensor of the vocal cord. Cricothyroid tense the vocal cord. Vocalis muscle tense the vocal cord. Thyroepiglotticus, which is relaxer of the vocal cord. Now we are discussing about inlet of the larynx. Now when we go seeing the cavity of the larynx, when we cut the cartilage of cricoid cartilage, alternate cartilage, we now enter the cavity of the larynx. The end of the larynx, both sides we have a piriform fossa. The piriform fossa medially ari-epiglottic fold, laterally thyrohyoid membrane and thyrohyoid cartilage. Now when we open this cavity, we see upper part and lower part. We have two folds above, two folds below. The above two folds we call as the vestibular folds, and below two folds we call as the vocal folds. So the quadrilateral membrane, which arises from the epiglottis to lower part of alternate cartilage to form a thick and It's called conus elasticus. Conus elasticus. And the both sides form a ligament. It is called vestibular ligament. There is quadrangular membrane of mucous membrane, which is from the cricoid cartilage to the base of the adenoid cartilage. Form a cricovocal membrane. Cricovocal membrane. Form a vocal ligament. So this cavity we divided into three. The above the vestibular fold we call as the supraglottic part. And the middle part we call as the glottic part, and the lower part of below the vocal fold we call as the infraglottic part. So two vestibular ligaments, vestibular folds, between we have a space we call as the rima vestibuli, whereas in between the two vocal folds we have a rima glottidis. The center we have a opening, slight opening, that is called saccule of larynx or sinus of larynx. Now what we have in the center? Sinus of larynx. Okay. This glottic compartment is very important because above the vocal fold, internal laryngeal nerve is supplied. If it is internal laryngeal is damaged, anesthetize this area. So protective cough will be affected. Below the vocal fold is supplied by recurrent laryngeal nerve. All the muscles of the larynx supplied by motor supply supplied by superior laryngeal and external laryngeal nerve, branch of vagus, whereas sensory above the fold, internal laryngeal nerve, below the vocal fold we have a recurrent laryngeal nerve. So blood supply of the larynx above the vestibular fold, above the vocal fold, superior laryngeal artery is a branch of superior thyroid artery, whereas below the vocal fold we have a inferior laryngeal artery is a branch of inferior thyroid artery. So venous drainage, superior laryngeal nerve which drains in the superior thyroid artery, inferior laryngeal nerve is drained in the inferior thyroid artery. Lymphatic drainage, above the vocal fold we have a upper deep cervical lymph nodes. Below the vocal fold we have a pre-laryngeal and pre-tracheal lymph nodes which is drained in the lower deep cervical lymph nodes. Now come to the clinical anatomy. Infection, clinical anatomy. Infection of the larynx we call as the laryngitis. So already discussed, motor nerve supplied by internal and superior laryngeal nerve and external laryngeal nerve. If this external laryngeal nerve is affected, mild phonation will be affected. The internal we have sensory supply. Above the fold we have internal laryngeal nerve. If it is damaged, what happens? The supraglottic part will be affected. So protective cough will be lost. Any foreign body during food intake easily is affected. If it is the recurrent laryngeal nerve will be affected, hoarseness voice will be occur. If it is external laryngeal nerve and recurrent laryngeal nerve is affected, so cadaveric position will be occur. So abduction of the inlet of the larynx. The saccule of the larynx, what happened? It is a bulge, laryngocele. What happened? Bulge is extended up to the thyroid membrane. During laryngoscopic, will damage the tunnel. We have to take careful when going to the laryngoscope. Normally, with the manner of